inviting me to be part of the summit. Innovation has actually advanced healthcare delivery and has enabled development of new products and new services, and also allowed us to find new ways of doing things. Like change, innovation is inevitable. And this is because of the healthcare environment that is changing, whether we're talking policy, funding, accountability mechanisms, and also issues like COVID-19, which are public health emergencies. Also, this has been a result of new knowledge that is coming out of research and some of the challenges that are being experienced in healthcare. So for today's discussion, I'm just going to focus on health technology and not innovation that has to do with the development of drugs and vaccines, etc. So just going back to the basics, the objectives of healthcare. So basically, healthcare is the function and the objective is to improve health, improving quality of life, and then to save lives. So there are two elements, one being proactive and the other one being reactive. If we're talking about proactive and the role of innovation is in healthcare promotion and ensuring that people have access to credible information through technological platforms, and also early detection of medical conditions and diseases. And on the reactive side, it's basically the interventions on patients that already have been diagnosed, whether with chronic diseases or that have accessed health care for acute services. So innovation plays a significant role here because it can also allow remote monitoring of patients, and also because of connected care, it can facilitate coordination of care amongst caregivers that are looking after a patient. Let's take, for example, a patient suffering from asthma or diabetes. So today's topic, what I'm talking about is healthcare innovation and ethics. So it's important that I touch briefly on the four principles of ethics, which is respect for persons and their free will, which means that people should give consent or should consent to utilizing, new technology and the innovations, and they need to understand what are the benefits and the challenges or risks associated with that so that they can make informed decisions. And then it's to do no harm and to do good, and fairness, which is justice, basically referring to the fair distribution of burdens and also the benefits. So ethical considerations that are important and impact analysis that is critical when it comes to healthcare innovation is to ensure that ethically that all these innovations that are coming out are accessible to members of to different members of the population, and they are safe. They don't expose them to physical harm, emotional harm, and also harm when it comes to their human rights being violated. And let's take, for example, their information that is stored online being easily accessible by other people who are not authorized to have that information. It must also be patient-centered. When you talk about patient-centeredness, obviously, if we talk about connected care, the care provided must be precision medicine that is individualized because the data is available that is unique to a specific patient. But if you look at the population, we also need to look at, acceptability and the fact that the solutions and those innovations take into account cultural preferences and take into account barriers to accessing, these technologies, whether we're talking language or to access them, online. So the appropriateness, I've spoken about it, and then the transparency and the trust. It's so important and critical when it comes to big data and AI solutions because of, bias that is a risk. So once again, when we talk to the innovators, it's all about being aware of those challenges that might come with a bias, which is unintended, because some of these solutions are based on historical data, and those care decisions were made by human beings who have implicit bias. So that awareness is critical so that it can be managed, and then structural injustices cannot be perpetuated by the technology. So issues of racial biases and gender biases, just to name a few. And informed consent, it's the importance of ensuring that when it comes to innovation and new technology, one, it's a safe technology that needs to go out. And then two, it's also just making sure that people that are utilizing the technology, whether we're talking apps and other technologies, they need to, agree to those platforms or utilizing those platforms based on truthful information with regards to how their data is going to be used and who will have access to it, and also should they change their minds or decide to exit a program, what is going to happen to their data. So again, when it comes to health technology, issues of accountability becomes important. It's a area that is being debated with regards to, let's take, for example, AI solutions that give advice on how to manage a patient, whether legal liability lies with the health practitioner or with, the AI solution. So those are things that we need to keep our minds, and then to ensure that whatever solutions and technology that is out there does not do harm, and should there be harm, there must be an entity that is being held accountable. But looking at AI, it's there to assist, but still practitioners need to make decisions. So innovation should aim at eliminating barriers of accessing new products and services. So addressing issues of cost, reducing the cost of healthcare, and then in areas where there's internet connectivity issues, like people in rural areas, they tend to be discriminated against unintentionally because of poor connectivity where they're at compared to people that stay in towns and cities. So those are issues that need to be addressed to ensure that the solutions are accessible to everyone and they don't discriminate, even though it's unintentional. So issues of tech literacy and language barriers and social demographic inequalities, they need to be taken into account when implementing and rolling out technological solutions. So when it comes to innovation, there must be an ethical and a legal framework that gets applied to ensure that innovation provides the benefits and it does less harm, it doesn't perpetuate inequality and structural injustices, and that if there are any new sacrifices that need to be made, like the surveillance that we've seen with COVID-19, it must be ethically justifiable to benefit the individual and the society at large. It must not be the source of social problems and conflict because of biases that have to do with demographic factors like age, gender, and racial groups. And again, it's important to ensure that and to understand that technology innovations should enable access to care, enable access to quality care, enable access to credible information. So the ethical impact analysis needs to be conducted to ensure that it achieves the intended objectives and that it avoids undesired and unintended consequences. So in a nutshell, healthcare innovation should advance humanity. It should improve access to care, improve access to quality of care, and also assist in reducing the cost. And once again, the social injustices that sometimes we find in political structures, government structures, we need to make sure that it doesn't get perpetuated by the technology that is being implemented. Thank you.
So one of the things that I do is in my work is that I'm an e-patient scholar, And what an e-patient basically is a patient that uses the internet to manage their own health condition better. And it's a very, very important part of how we design technologies and how the internet is, or technical, the applications are being used by patients to understand. Because when we look back on the way that the internet and technologies first emerged, back in my days, when I went to my doctor, it would be a very paternal model of care. But as the internet has changed things, it's become more of a participatory relationship. So what that means is information and digital technologies are empowering patients. We might be at different levels, but as technologies improve and as the internet improves, so should patients using these technologies be able to become what we call emancipated. There are actually 10 E's to an e-patient, and it was originally research that was conducted by a doctor, American doctor, called Tom Ferguson. And what he looked at, back in the 1990s, when the internet first opened to the public, there was a term first coined called a cyberchondriac. And the reason this term was coined was because patients were looking up their conditions, they were trying to seek out data, more information on the internet to try and understand what was happening to them, and they would present that kind of information to their doctor in a panic state because they didn't know how to put these pieces of information together. As obviously the doctor did, having access to suddenly medical journals and that sort of thing. So cyberchondria became, it was a very negative thing for patients to use the internet to find medical information. But this medical researcher, Dr. Tom Ferguson, saw it differently, back in the 90s. In fact, from the 70s, he was a advocate for patients empowering themselves, and particularly with using different data sources, as I say, the internet, to do that. So he coined the term e-patient. So the E means a whole lot of things. It doesn't just mean enabled or electronic. It's I always call it the 10 E's. So it's evaluating, for example. A good digital patient is evaluating. So in other words, when they've reached that point that they are an e-patient, being an evaluating e-patient, they can look at certain types of information that they're gathering, because they are hunters and gatherers of information, and they can evaluate what they're reading. So for example, let's say vaccines cause autism, or they will evaluate that information before believing it or sharing it with others. Emancipated is a good E, because emancipated means that the digital technology that's being designed should emancipate the user, the end user, the patient that's using it on the other end. So in other words, if you are somebody that is designing a mobile application to help somebody manage their diabetes, it doesn't help if what you are designing is not emancipating that end user, that patient. So you need to use those E's as a goal to the way that you design your own, the technologies that you're putting out there, particularly in Africa, because Africa has so many different divides, digital divides. So for example, access to the internet. If you go and you design a mobile application, which you'll put out into a rural area and the connectivity is really bad, and in that mobile application you say, well, we're going to use videos to help people understand in different languages what a particular medical condition is about. If data is very expensive, and again, this is going back to the digital divides that we need to understand. If data is very expensive, then there's no point in trying to design an app for Africa that doesn't consider that first. And of course, you don't want to go through with the whole writing medical journals. You need to also target plain language and different language. So all these demographic, cultural, ethnographic sort of data matters to how we design technologies. And also there's something else, is using human-centered design principles. And what that basically means is that we work together with different stakeholders, user experience design, to understand exactly what it is that they need. So that's what I do a lot in my work. I work with medical researchers. I'm actually an advocate for antibiotic resistance, and I work with them to tell them what the barriers that I experienced were, to tackle and to manage a very, very severe condition, which nearly cost me my face. And that's why you can see the disfigurement on the right-hand side, and the eye loss. That was through a car accident. And then, you know, later on using the internet to try and understand how I could play a role in managing my own condition better. So so the ultimate, you know, going back to the e-patient again, while we're designing technologies, it's going to get more complicated. So so right now, e-patients are using things like Web 2.0, which is your social media. Doesn't necessarily have to be Facebook or Twitter. It could be, you know, social media platforms that were designed for healthcare only. Okay, so I'll give you an example. There's one called patientslikeme.com or inspire.com, where it's all user-generated information, you know, mainly by patients. That is much more secure than an open public platform like Facebook to connect and create communities. Then when we get to Web 3.0 patients, and how they're using these technologies, for example, smart connected pills, prescriptions. Okay, so for example, your prescription box is digitized, and it tells it sends information to your medical record saying that you've remembered to take a pill at a certain time. Your smart fridge, your smart TV, that's kind of the whole idea behind Web 3.0, and using these different connected devices to manage your health better in terms of your medical record. So Web 4.0 is really taking it up even a higher notch, where in my case, it would be a case of getting a bionic eye that it's connected to my brain because I'm partially blind on one side, and that data that generates ends up on our medical record. But we as patients, you know, it doesn't help just to, for example, give me a bionic eye and say, here you go, you know, you must deal with it now. We need to be empowered. We need to be upskilled. We need to be educated so that we can participate. And so this is really, it's digital health isn't just about, it isn't one-sided. It's multi-sectoral, and it's inclusive, and it's participatory. So to end, you know, if you want to read more about the e-patient movement, you can go to epatients.net. That's where the e-patient white paper is. And my work can be followed on vanessacarter.co.za.